Fiancé Romanillas, and today I'll be performing the return demonstration of perineal flushing. So this procedure is done to maintain the cleanliness of the perineal area, reduce the risk of infection, provide comfort, and support healing. It is essentially important for patients or clients who are bedridden, postpartum, or recovering from a surgery. Now, prior to the procedure, I have already prepared all the necessary materials to save time and energy and washed my hands to prevent cross-contamination. Now we have here my protective sheet, my bedpan, my kidney basin, my warm sterile water, my sterile forceps, my working gloves, my perineal pad, 8 cotton balls soaked in cleansing solution, 8 dry cotton balls, and then now I am going to explain the procedure or the treatment to the patient to provide information, gain cooperation, and ensure informed consent. Good morning, ma'am. I'm Daniela Bianciro Manilias po, and I will be your student nurse for today. Can I please check po for your identification bracelet to confirm your identity? Thank you. Can you please state your full name, ma'am? And your date of birth? Okay, Miss Yu, today I'll be doing perineal flushing. So this will help clean the area, prevent infection, and keep you comfortable. Do I have your consent to proceed, ma'am? Thank you. I want you to feel safe, comfortable, and respected throughout the process. So your privacy and confidentiality will be maintained at all times. Now, I must provide patient privacy by locking the door of the patient's room to maintain dignity and comfort. I will now wear my working gloves to prevent cross-contamination of microorganisms and ensure the patient's safety. Now I have positioned the patient in dorsal recumbent to provide proper exposure of the perineal area with her knees flexed or slightly bent. I will now place a protective sheet under the patient to prevent the bed from being soiled and ask the patient to turn to her side. Okay, ma'am, I'll help you gently po to turn to your side for so that I can place this protective sheet under you, ha? Okay, 1, 2, 3. Turn it back. Now I'm gonna place the bedpan under the patient's buttocks to catch the water and any other secretions. Okay, ma'am, I will assist you to lift your hips a little so I can place this bedpan under you in the count of 3. 1, 2, 3. Okay, now I will drape the patient, exposing only the parts to be cleaned or cleansed to maintain privacy and warmth as I start the procedure. Okay, now I will flush the perineal area with water to remove loose secretions and discharges before detailed cleaning. Now, I will use cotton balls soaked in cleansing solution and discard each after use to maintain hygiene. I will also put the kidney basin near the patient's perineum for easy discard of the cotton balls. Now, I'll start cleansing the external genitalia from the midline of the symphysis pubis down to the anus without retracing a stroke. So this prevents microorganisms from spreading to the genital area. And discard. Now, with a second cotton ball, I'll clean the external labium in a figure of 7 motion from the mons pubis towards the anus, then discard. So this ensures thorough cleaning of the external labia. Now we must always remember that we should start from the farthest side to the nearest to maintain sterility. Now with the third cotton ball, I'll clean the internal labium using the same figure of 7 motion. So this prevents contamination while removing secretions. Then with the fourth cotton ball, I'll clean the other external labium with the same stroke as on the other side. So this ensures both sides are cleaned equally. Now, with my fifth cotton ball, I'll clean the other internal labium with the same downward stroke as on the other side. Then, with the sixth cotton ball, I'll clean the groin area from the thigh down to the groin. Then I'm gonna use the other side of the same cotton ball for the near groin. So this prevents skin irritation from sweat or secretions. Then, with the seventh cotton ball, I'll clean the opposite side of the groin area. So with the same procedure to make sure that both sides are cleaned well. Now, for the last cotton ball or the eighth cotton ball, I'll clean the midline again from the symphysis pubis down to the anus, as this ensures the final cleaning of the central perineal area. Now, I'll flush the perineum thoroughly with warm sterile water to remove residue and provide comfort. Then, using dry cotton balls, I'll dry the perineum with the same stroke in cleaning. So this prevents infection from moisture accumulation. Now, I'll remove the bedpan gently and turn the patient to her side to prevent spillage and provide comfort. Okay, ma'am? I'll gently assist you po so that you can turn to your side. Then, if necessary, I must clean the patient's buttocks from one side, then the other, and dry both of the patient's buttocks. So, this maintains hygiene of the surrounding areas. I'll also remove this one. Then I turn the patient back on her back. Then I'm gonna place a perineal pad with an up-down motion if needed. So this prevents the skin from further discharges. Okay, ma'am, I'll place this onto you po, ha? Thank you for allowing me to do the treatment to you. Then I'm gonna perform aftercare of all materials used to keep the unit clean and prevent infection. Lastly, I'll record the treatment done to the patient and the discharges observed. So this serves as legal documentation for continuity of